Do you consume a high amount of salt? Can't resist foods with a high sodium content, such as French fries, sausages, and processed foods? Do you suffer from hypertension? Or do you spend most of your time sedentary, without physical exercise? And do you believe that your blood pressure medication alone can solve the problem of your hypertension? Think about it. In this video, I will address the 5 serious and common misconceptions that a hypertensive person should not make. In case you or any member of your family is incurring in any of them, it is important to correct them as soon as possible, as this may result in a series of complications that will affect your health. Hypertension is the leading risk factor leading to mortality in the world. More than smoking, more than having diabetes, obesity, or high cholesterol. Hypertension is like a looming threat inside us. If we are not careful, it can trigger and cause significant damage to our body, such as heart problems, strokes, kidney disease, and even eye damage. It's a serious thing. Do you make any of these serious mistakes? Are you harming your own health? I hope not. I won't judge you if you are making these mistakes. I am here to help. However, mistake number 1 is the most common, so stay until the end to discover it. But before we continue, we would like to ask for your active participation in this channel dedicated to health. We know how important it is to receive valuable information about caring for the greatest asset in your life, which is your health. Enjoy the video, because the more people enjoy it, the more YouTube will distribute it to those who don't have access to doctors or hospitals. There are many people with hypertension. By sharing the video with your friends and family, you will be helping. So don't hesitate, share. And tell me, do you suffer from hypertension and do you make any of these 5 mistakes? Which part of the United States or the world are you from? Write below. Let's go. The pressure reading you get on your home appliance or at the health center is related to the pressure to which your circulation is being subjected. Think about it, when the blood pressure is high, our internal organs suffer the consequences. The heart, for example, has to work much harder to pump the blood, which can result in serious heart disease, such as heart attack, angina, and heart failure. And the brain doesn't escape this either. Uncontrolled hypertension increases the risk of strokes, being the main cause of both ischemic and hemorrhagic strokes, and can even lead to death. It is a real danger. Hypertension accelerates the aging of blood vessels, making them stiffer and increasing cardiovascular mortality. But do you know what the main problem with hypertension is? It is that it is silent. It doesn't cause nosebleeds, headaches, chest pains, or shortness of breath. So there are many people out there who don't know that they are hypertensive. According to the hypertension consensus, everyone 18 years of age and older should have their blood pressure measured at least once a year at the doctor's office and be aware of their values. So, what are the 5 serious mistakes a hypertensive person cannot make? Mistake number 5, not measuring blood pressure or measuring it incorrectly. Checking blood pressure at home is an important part of treatment. Do you have a blood pressure device at home? Is it properly calibrated? It is important that you take your blood pressure at least once every fortnight or twice a week at different times. Why? The only way to know if the medications are working is to regularly monitor your blood pressure. This gives you a sense of control over your illness, that the non-drug changes such as exercise, diet, and sleep are working. You feel more motivated when you realize that your blood pressure, which used to be 14, now consistently stays below 11. Also, the blood pressure measurement at the doctor's office is different from the one at home. Some people get tense during the visit and their blood pressure goes up, white coat hypertension, or on the contrary, they relax when they visit the doctor and their blood pressure normalizes, but at home it stays high, what we call masked hypertension. By measuring regularly at home, you are helping your doctor to better monitor your treatment. How do I measure my blood pressure correctly at home? First, 30 minutes before the measurement, you should not smoke, drink coffee or caffeine, and should not have exercised. In addition, it is important to empty your bladder. 5 minutes before you start, sit down and remain seated. During the measurement, the cuff size should be appropriate, especially if you are obese. Uncross your legs, sit properly and let your arm rest on a straight surface, such as a table, at the level of your heart. After the measurement, you can take another measurement, just to make sure that the measurements are correct. It is essential that you measure your blood pressure. Taking 2 measurements a week is healthy and important. But be careful about false news. Also, there is a lot of incorrect information out there. Aren't you taking your blood pressure? No, I am. I bought a cell phone application. However, these cell phone apps in my opinion are not very reliable. The fourth serious mistake is the opposite, taking pressure all the time. As with everything in life, extremes are not ideal. If you only measure your blood pressure when you go to the cardiologist once a year, it is too little. But taking your blood pressure all the time is also too much. I want you to have a device at home that is functional, certified, and from a reliable brand. Why is it not good to take your blood pressure all the time? I have a headache, I'll take it. I'm agitated, I'll take it. I'll check my blood pressure before I go to sleep. There are people who spend all the time taking their blood pressure, and this harms their quality of life. Why? Because the numbers they see on the display create anxiety. Gee, my blood pressure was 11 half an hour ago, now it's 13, so when I go to sleep it will probably be 15. And in the middle of the night it's going to be 18, I'm going to have a stroke. And then they wonder why the pressure doesn't go down. It should go down. What they do now. That's exactly it. It's no joke. Avoid doing that. Don't constantly check your blood pressure. Stress causes your blood vessels to contract due to the release of adrenaline and noradrenaline. Imagine what happens when you squeeze the water hose in your house. The water gushes out with more force and pressure. Stress has the same effect on your arteries. Measure your blood pressure twice a week, or, if you've had a blood pressure chart and your cardiologist says everything is fine, it can be once a week or every fortnight. Not when you are feeling something, but when you are calm and relaxed. Don't worry so much about an occasional pressure reading, but rather about your pressure overall. Focus on the forest, not the trees. If your blood pressure generally stays good, you can disregard a high reading on a day when you slept badly and had too much coffee because of an important exam at college the next day. Let me ask you a question. Have you ever had an exercise test? Your blood pressure came up to 180/90. Is this dangerous in the exercise test? Probably not. This is normal, because your body needs to pump more blood to supply the leg muscles better when you are running on a treadmill. So the message of this mistake is, don't create more anxiety and don't harm your psychological health by measuring your blood pressure all the time. Let's go to the next mistake, mistake number 3, adjusting the medication on your own. You measure your blood pressure, it is high, and you decide on your own to double the dose of the medication. This is something I see very often. The patient says, look, I was taking the medicine, my pressure was still high, so I decided to double the dose of the medicine. However, that person didn't understand that 40 milligrams was already the maximum dose of the medicine. Doubling the dose will do no good. It will only increase the side effects of the drug, double the costs, and can have harmful effects. The correct thing would be to return to the doctor's office so that I could prescribe another drug, which would be more effective and would not overload the patient's body. There are other cases in which the person doesn't have a diagnosis of hypertension, is going through stress and decides to measure the pressure, which is high, and decides to take his wife's medication. Schedule an appointment to check and mention this problem. And you don't know why you have become impotent. Because the medicine that was prescribed for your wife is one, and for men is another. Treatment is personalized, medicine is more and more focused on precision and individualized medicine. There is no standard prescription. Self-medicating and changing the dose of the medicine on your own, without consulting your doctor, will make treatment more difficult and can cause harm. Instead of self-medicating, the right thing to do is to calm down, rest, and take your blood pressure again after 15 to 30 minutes. Report this to your doctor at your next appointment, or if your pressure is too high, for example 180/120, go to the emergency room. Mistake number 2, thinking that because you are taking the medication correctly, you don't need to change your other habits and follow non-drug treatment. Well, the medication is important, but you need to do your part to fulfill your responsibilities. Reduce your salt intake, or better yet, replace salt with reduced sodium versions, such as light salt, if you don't have problems with excess potassium or chronic kidney disease. Why? Sodium retains liquids, and potassium can balance the effect of sodium, eliminating excess liquids. Light salt contains 50% potassium. There are studies, one of the largest studies ever conducted on dietary intervention, conducted in China and published in the journal Circulation in 2021, that have shown that light salt can reduce the risk of stroke, heart attack, and dementia. Look at that, an easy, inexpensive intervention that has an impact on your health. But of course you need to adjust the rest of your diet. Avoid consuming too much salt or foods high in sodium, such as processed foods, yellow cheese, sausages, snacks, and soft drinks, including zero soda. It is important to eat more fruits and vegetables, which help normalize blood pressure. Stop smoking, reduce or avoid alcohol consumption, lose weight if you are overweight or obese, exercise regularly, sleep well, and reduce stress. All this together contributes to gradually improving your blood pressure, and perhaps, in time, your doctor may reduce or discontinue the medication. And the first mistake, stop taking the medication because the pressure is excellent. If your blood pressure is constantly low and you are experiencing symptoms such as postural hypotension and dizziness, talk to your doctor. It's not you who should stop the treatment. But that's not even the biggest problem. The person is taking 2, 3 antihypertensive medications, and his blood pressure is well controlled, 120/80, and decides to stop everything. This will certainly cause problems. This is often the case with patients. This morning I measured my pressure and it was 110/70, so I didn't take the medicine, otherwise my pressure would be too low. Well, the measurement you took this morning, the medicine you took yesterday was still taking effect. The new antihypertensive drugs have a long half-life and take time to be eliminated from the body. You should not take your blood pressure to decide whether or not to take the medicine. You should take it every day. Let me explain a concept that you may never have heard. The newer drugs are antihypertensives, not hypotensives. This means that the medication will not lower your blood pressure, but rather normalize it. The drop in pressure is proportional to the level of hypertension. There is an interesting study called the Pianist study, in which the same fixed dose of 3 combined antihypertensives, perindopril, indapamide, and amlodipine, was given for 4 months. What happened was that the pressure stabilized over time. It was higher in the first month than in the 4th month for all groups. The mild hypertensives did not become hypertensive, the pressure normalized. The moderate hypertensives also did not become hypotensive, the pressure normalized, and the severe hypertensives, whose pressure was very high, improved significantly, reaching acceptable levels. In other words, the latest drugs are against hypertension and are not aimed at lowering pressure. So, if your pressure is normal on the day, take the medication as prescribed. In Portugal 55% of people, in Canada 66%, and the country with the best control is South Korea, with 72% of hypertensive people keeping their blood pressure under control. Good blood pressure control reduces the risk of stroke, heart attack, heart failure, hemodialysis, and mortality. Take good care of your blood pressure. Try to avoid these 5 mistakes as much as possible, and everything will be fine. You will cope with it easily. Remember to always consult your doctor before making significant changes in your life, especially if you have pre-existing medical conditions. Take advantage of all the tips and take care of your health in a holistic and balanced way. Did you enjoy the video? We hope this information was helpful to you. Don't forget to like the video, subscribe to the channel, activate the little bell to receive notifications, comment on your doubts and suggestions, and share with your friends and family. I will leave 2 relevant recommendations here for you, a playlist related to this topic and a video about when you should take your blood pressure medicine. Don't forget to subscribe. And until the next video. Thank you very much.